How would you like to escape stress using simple imagery and relaxation techniques? That's the intention for this 15th video in a series for my monthly blog at letmagichappen.com. I'm Dr. Larry Burke, author of Let Magic Happen, Adventures in Healing with a Holistic Radiologist. For more information about these approaches, check out Chapter 7 in my book, Anodyne Means No Pain, or the Anodyne Imagery technique in the appendix. Healthcare professionals who want more formal training in hypnosis should look at the American Society of Clinical Hypnosis website, which is ash.net, A-S-C-H. And that will get you started in learning techniques that you can use with your patients. Now, the purpose of this video is for your own personal use in going through any sort of anxiety-provoking procedure. One of my teachers, my Anodyne Imagery teacher, Donna Hamilton, used this approach to get through a painful dental procedure with not even any Novocaine. My hypnosis teacher, Holly Forrester Miller, actually used it to go through major abdominal surgery with no anesthetic whatsoever. Now, most people don't really want to go that far and might still take a little Novocaine for their dental procedures, but want to use less medication and be more comfortable during the whole process. Even simple things like having blood drawn is a good place to practice this kind of approach. So I'm going to do 4 different steps in the process. The first is just letting your healthcare professional know that you're going to be using these techniques during the process, and also that you prefer to have them use positive language throughout. As a radiologist, I was taught that when giving a local anesthetic to say it's going to be like a little bee sting and then it's going to burn. And those are the last 2 things a patient actually wants to hear. So much better to focus on comfort or even discomfort rather than pain. So the next step in the process is to learn color relaxation breathing. In this use, you assign a nasty color to your stress and blow it out, and then breathe in your favorite color of relaxation, then blow out whatever you want to get rid of. Third step is to go to what's called the preferred place, which is some comfortable, safe, secure spot where you can hang out while the procedure is being done. For example, this would be one of my patients who was undergoing a radiology procedure, went and ate a 5-course meal at his favorite restaurant and was fine during the whole procedure. The fourth step is to use imagery to reframe any symptom you have during the procedure. So any pain or discomfort, you can change the image and change your subjective experience. The very first Anodyne Imagery patient in California that Donna Hamilton had was a guy who had terrible abdominal pain, and the image that he got for it was of a red raw piece of meat with a butcher knife stuck in it. She just asked him to do something to make the image more comfortable, which was to make it black and white, push it away, make the knife a toy knife, pull it out, and his experience of pain diminished significantly, as did his need for medication during the procedure. Alright, so we're going to get started so you can have a full experience of this. So the first thing is just ask your healthcare professional to focus on your comfort level as opposed to how much pain you're in. Always better to focus on what you want, not what you don't want. Next is to do the relaxation breathing with color. So whatever your stress is, assign a color to it, some nasty color. Go ahead and blow that out. Take a deep breath in of your favorite color and relax. And then let go of whatever else you want to get rid of. Okay, good. Now you're relaxing, and you can use that breath anytime you need to relax even further and go deeper into relaxation during any procedure. Next, ask yourself the question, where would I rather be than here in this procedure room? And then give yourself permission to go there for the duration of the procedure. So it often helps for it to be out in nature somewhere, a safe, secure, comfortable healing spot that you're familiar with and that you can get really connected to. Use all 5 of your senses to get there. So Imagine what you're seeing there, what you're hearing, what you're feeling, what the smells are like, even what you might taste there. And once you're there, make sure you're looking out through your own eyes at the scene and explore around and get a 360 kind of feel for the place. Take another relaxation breath in this place of the nice refreshing air. So blow out anything you brought with you, breathe in the refreshing air, and let go of anything else you want to let go of. Now while we're here in this comfortable place, I'm going to play around with the images to give you a sense of just how subjective the experience is, and notice what happens when you change the images. It's called changing the submodalities of the image. So imagine you have a remote control device in your hand that can control the image qualities. So go ahead and find the color control, and if you're seeing in color already, make the colors more vivid, make them less vivid. If you want to actually drain the color out altogether, you can turn it completely to black and white. If you're already wearing black and white, turn the colors on and play with turning them on and off. This gives you the sense that you actually do have some control over this process. Next, imagine that there is a function on the control that allows you to jump in and out of your body. So if you're looking out through your own eyes now, hit the eject button and jump out of your body so that you're actually seeing yourself in the scene. Look at yourself in 3 dimensions and 360. Notice what that feels like. Then there's a zoom button that will allow you to zoom in and out of the image. So go ahead and hit the zoom away function so you're moving further away and you look smaller, and everything in the image starts to get smaller, so you're moving away from it. Notice how that feels. Then zoom back in so that you're getting much closer to your body and back to full size, and then hit the jump in and out of your body button and jump back into your body so that you're now looking out through your own eyes again. And notice how that feels. So you should be back in the full scene now with full color, looking out through your own eyes, feeling very grounded in that safe place. Once you've had that experience, let's do one more relaxation breath. So blow out anything you still want to let go of. Take in a nice fresh air and memory of this place. Know that you can come back here anytime. And blow out anything else you want to get rid of. Now I'm going to count to 3 and bring you back to your normal environment. So you'll be refreshed and awake and alert when you come back. Number 1, you're noticing the chair you're sitting on. Number 2, you're noticing the light coming into the room, hitting your eyelids. 3, you're opening your eyes, stretching, coming back into the room. And now you're fully back and oriented to where you were when you started out. And the final step in the process is to play around with the images that relate to any symptom you might be experiencing. So check in your body if there's any tightness, stiffness, pain, discomfort, anything you're noticing. And once you've tuned into that, close your eyes for just a second and allow an image to pop up out of there. Take the first image that comes that symbolizes whatever you're dealing with. Once you've got the image, then you can play around with it and notice what happens when you take the color out of it. Notice what happens when you push it a little bit further away. You can shrink it down so small you can hardly even see it, and you can even magically transform it into some more positive image. And you might want to practice this technique anytime you do notice any symptoms that you have once you've gotten used to practicing these techniques. Okay, well that's the basic 4 steps in the Anodyne Imagery process. And if you want to Again, if you want to learn more about formal hypnosis, go to ash.net. If you go to letmagichappen.com, you can also check out my blogs and newsletters, which have a lot of other information on them, and also check out my book as well. It's available on Amazon. So, enjoy your future imagery trips, and let magic happen. Thanks.